X-ray showing you some dense calcification on the surface of the heart. Okay, why has this happened? And I said fibrous calcification. So you can say fibrocalcific type of heart surface, or you can say fibrocalcific pericardium. Both are correct. Okay, and this will not allow the heart to expand. So this is constrictive pericarditis, constricting the heart. Okay, and as a result, you start hearing abnormal heart sounds. Okay, specifically, what heart sound would you hear now? That was one of the feature in our question. What heart sound would you hear? I have that also in one of the other questions, and I'll show you how it looks like. I have a video to show you how it looks like actually. Okay, so let's do the question to see what that heart sound is. Okay, so let's go to that question. So this is a 29-year-old, okay, pretty young, no significant past medical history, presents with progressive exertional dyspnea, lower extremity swelling, 3 weeks, recovering from self-limited febrile illness with myalgias and sore throat. So myalgias, sore throat, okay, probably some, can we say viral illness might have happened? Okay, let's not jump to a conclusion, but that's what we are thinking here now. He now complains of orthopnea, paroxysmal nocturnal dyspnea. These are pretty interesting findings in a very young person. Orthopnea, paroxysmal nocturnal dyspnea. So, do you understand the meaning of this word? Paroxysmal nocturnal dyspnea. Nocturnal is, of course, at night while sleeping. Dyspnea, difficulty breathing. Paroxysmal, it's like a sudden thing. Okay, paroxysm is like a sudden attack. Sort of, you can use that description for this word. Paroxysm. So paroxysmal nocturnal dyspnea. Suddenly, the person is feeling short of breath, and I mean, many questions in your Q banks describe the situation as somebody waking up suddenly at night and gasping for air and looking to open windows or opening doors and trying to breathe more air, right? That sort of thing has happened here. On exam, blood pressure is 110/68, heart rate 102, okay, respi 22, elevated JVP. So a lot of stuff is happening here. Bilateral crackles at the lung bases, so definitely fluid in the lungs. So all of this has told me definitely, right? S3 gallop, very interesting. This sound S3 gallop is interesting. So 2 plus pitting edema of the ankles. So again, uh, there is definitely heart failure that is happening here. Okay, it looks like a global heart failure happening. Cardiac MRI, okay, perfect. They might not have given this information, but they gave this information. Okay, I'm pretty happy with this. MRI reveals globally reduced left ventricular systolic function. They've actually given you the diagnosis here. Okay, so globally reduced left ventricular systolic function with 4-chamber dilation. So have we narrowed down our diagnosis? We should have, right? So this is now dilated cardiomyopathy that has happened here, isn't it? Further, they also give us biopsy findings. Okay, pretty solid, full case question. You may not see this type of question in your comp exam. USMLE Step 1, they do that. Endomyocardial biopsy shows patchy infiltrates, interstitial infiltrates, predominantly composed of lymphocytes with necrosis. So this also confirmed a lymphocytic infiltrate in the biopsy, which confirms what? A viral infection. Why this question is important? Okay, we got the diagnosis. This is dilated cardiomyopathy. Okay, firstly, you should know what the features of dilated cardiomyopathy are. There are so many things happening here, so many features given to you. Okay, MRI features, okay, clinical features, okay, and another thing that I would want you to learn today is what caused it here. Causes of dilated cardiomyopathy. There are many causes for dilated cardiomyopathy, and overall, out of all types of cardiomyopathies, dilated is the most common one. Why is dilated cardiomyopathy the most common one? Because there are so many causes, so many reasons that can lead to this. So many things. In this question, what is the reason for this patient who has developed the dilated cardiomyopathy? It is viral myocarditis. Viral infection happened, and they confirmed this viral thing. How do I know it? Because it's the biopsy. You would rely on your biopsies, won't you? I mean, everything depends on pathology reports, right? So, I mean, you should feel happy because pathology gives you all the information, right? And as a pathologist, we do give all of that information to all the clinicians. So, composed of lymphocytes, again, viral myocarditis that has led to this dilated cardiomyopathy. Okay, so answer would be pretty sort of straightforward. I want to share the sound with you. I found one YouTube video, uh, and I'm going to play that sound now. If you don't hear it, just let me know. Okay, I'm going to play that video next now. Okay, so you can put your headphones on, or you can increase the volume, and you'll hear that sound. Okay. Are you all hearing the sound? Okay, so let me play this. This was pretty interesting, isn't it? And you can learn it like in a musical way, or saying Kentucky, Kentucky, Kentucky. You see that the Y is the last, the third sound, right? Kentucky. So this is easier if you want to learn that. Sort of, I have it in my head always. This is Kentucky, Kentucky. That sound, right? I hope you were able to hear and see how it would look like, right? So this video was pretty helpful, I believe. Okay, so the correct answer to our question, of course, was the dilated cardiomyopathy. But what I want you to remember is dilated cardiomyopathy is the most common because it occurs due to many reasons. There are many, many, many etiological factors that can trigger this dilated cardiomyopathy.